What are Medicare's telehealth service limitations? Imagine being able to see your doctor from your living room, but then suddenly realizing not all telehealth visits are covered the same way. That's what we're here to clarify today. Medicare has rules about telehealth services that change over time. These rules were in place before the COVID-19 health emergency and are set to go back to the original restrictions starting October 1, 2025, unless Congress decides to extend them. First, there are geographic and site restrictions. After September 30, 2025, most Medicare telehealth services will only be available if you are in a designated rural area. Plus, you need to be physically present at an approved medical facility like a clinic or hospital to get coverage. If you are at home or in an urban area, most telehealth visits won't be covered anymore, with some exceptions. Second, certain types of healthcare providers will no longer be able to offer telehealth services that Medicare pays for. This includes physical therapists, occupational therapists, speech-language pathologists, and audiologists. If you see these specialists for telehealth after October 1, 2025, Medicare might not cover those visits anymore. Third, the use of audio-only or telephone services will be limited. During the pandemic, many telehealth visits could be done just by phone, but that will mostly end. Audio-only telehealth will only be covered in specific cases, such as when the patient is at home and cannot or does not want to use video. This includes services like mental health counseling, substance use disorder treatment, and end-stage renal disease home dialysis, but only under certain conditions. Behavioral health services are a little different. They will keep more flexible rules and continue to be covered without the strict location or site restrictions that apply to other telehealth services. For hospice care, in-person recertifications will be required again, which means telehealth can't be used for those assessments. Hospitals will also lose the ability to bill Medicare for outpatient therapy, diabetes training, and nutrition services provided remotely to patients at home. Providers are advised to give patients an advance notice called an advance beneficiary notice if they offer telehealth services that Medicare might not cover due to these rules. This helps patients understand what might not be reimbursed. For patients who got used to telehealth at home during the pandemic, these changes might mean traveling to approved clinics or hospitals for future visits. Providers will need to adjust their billing practices and be aware of which services are still eligible for telehealth reimbursement. Some programs like the Accountable Care Organization will still have some flexibility to provide telehealth services without location restrictions through 2025, but generally, the rules will tighten back to what they were before the health emergency. In summary, after October 1, 2025, most telehealth services will be limited by location, provider type, and technology used. Behavioral health and some chronic condition services will continue to have more flexible rules, but overall, access to telehealth will be more restricted than during the pandemic. Both providers and patients will need to plan accordingly for these changes.